Hi, I'm Rich Botner, Assistant Professor of Internal Medicine at Dzau Medical School and Director of our Support Hospital Opioid Use Disorder Treatment Texas or SHOUT Texas program. I'm joined this afternoon by my colleagues Aisha Salman and Matthew Stefanko. Aisha is a program officer at the National Academy of Medicine and works on the NAM's Action Collaborative on countering the U.S. opioid epidemic. Matthew is the director of the National Stigma Initiative at Shatterproof. On behalf of the National Academy of Medicine, Shatterproof, and Dzau Medical School, we extend a sincere, warm welcome to the National Stigma of Addiction Summit. Stigma and its many forms and manifestations create so many barriers for people with substance use disorders and addiction to receive appropriate, timely, evidence-based, and patient-centered care. Despite this, there is a relatively limited amount of research, resources, interventions, and activities dedicated to dismantling the stigma of addiction in our society, and in the context of today's conversation, in our healthcare system. That is why we are all here today. Aisha?
Great. Thanks so much for that introduction, Rich. Over 4,000 people have registered to be a part of this monumental discussion today about what stigma is, how it manifests in our communities, and most importantly, what we can do about it. Attendees at today's meeting represent a range of industries from government to academia, nonprofits, health systems, payers, community organizations, so much more, and include everyone from senior leaders to people providing direct patient care, individuals with lived experience, and everyone in between. This event has been almost a year in the making, and we are so glad to be collaborating between our three organizations to bring this event to you today. Special thanks to our planning committee, whose names are here on the screen now. They met bi-weekly for several months and have curated a fantastic and diverse group of experts for our program today. With that, I'll go ahead and turn it over to Matthew to kick us off.
Thank you, Aisha. We have a terrific agenda for today's summit, but we want you to know that the conversation does not end today. As you tune in for the remainder of the program, think about action. Consider what you might do differently as an individual moving forward, and just as importantly, think about how you might lead change in your own organization and in your own community. The Stigma of Addiction Summit has been built specifically to be action-oriented in this way. We'll talk more about this towards the end of our day together. If we could move to the next slide, I will kick off the event. I'm pleased to present the leaders of the National Academy of Medicine, Dzau Medical School, and Shatterproof to share a few words through this opening video. Can you please roll the video?
Welcome, my name is Victor Dzau. I'm the president of the National Academy of Medicine and the chair of our Action Collaborative on countering the U.S. opioid epidemic. Today's summit is focused on how stigma against those with addiction manifests across the health ecosystem, and importantly, the actions that are needed to combat the stigma and its deleterious impact. You know, our Action Collaborative is so pleased to be collaborating with Dzau Medical School and Shatterproof on this really important effort today. We all know that recent CDC data shows that more than 87,000 Americans have died of drug overdose in a recent 12-month period that ended in September, with synthetic opioids being the primary driver. This surge in mortality represents a 30% increase and is the greatest yearly toll of any year since the start of the opioid epidemic. What we are seeing may be a reversal of the progress that's been made in recent years and underscore the need for focused efforts to address the addiction crisis. In 2019, the National Academies produced a consensus report named Medication for Opioid Use Disorder Saves Lives. In this report, we identify stigma as a critical barrier that prevents people with OUD from accessing life-saving medications that they need. Stigma of addiction affects access to care, treatment outcomes, and broader health system factors. The impact of stigma across health system has led to the marginalization of patients with SUD. So making headway against addiction crisis will require addressing barriers related to stigma and discrimination. So we all know that stigma is the result of complex and powerful social processes. Stigma against those with addiction materializes as discrimination arises from structural and individual factors. Stigma of addiction is rooted in the historic separation of addiction treatment and financing from mainstream healthcare. Structural stigma is then reinforced by individual biases from clinicians and members of the public. Certainly, we know that patients with OUD report stigmatization attitudes from professionals within the health sector, further undercutting access to evidence-based treatment and care. Furthermore, evidence demonstrates that social stigma contributes to public acceptance of discrimination against those with addiction and public willingness to accept punitive and less evidence-based policies. So calling attention to stigma and building individual and structural competency within healthcare can be the stimulus to drive the needed change. There is, in fact, historical precedence for national efforts that have profoundly reduced stigma. Several ongoing individual initiatives are underway, efforts that use patient-centered strategy and advocate for transformational changes in health system and across the nation. However, in addition to these individual efforts, there's a need for a comprehensive cross-health system strategy to effectively address entrenched stigma. I think it's time for individual clinicians, healthcare organizations, payers, and health systems to commit to working collaboratively and leading the way for a cohesive, evidence-driven effort to eliminate stigma against addiction, to better meet the needs of those with SUD and turn the tide of this crisis. So I hope you have a great meeting, and thank you for your attention.
So welcome, everyone. It's wonderful to have you virtually here at Dell Medical School at the University of Texas at Austin. And it's wonderful for us to be a part of such an important event. The stigma of addiction is long overdue as a topic for discussion and research and action. So we're really thrilled to be a part of it. One of the studies that I'm most proud of that no one knows that I even did was on doing a deeper dive in what the NIH funds and basically plotting out NIH disease funding, how much is funded by disease versus that burden of disease for the United States. And it's pretty straight as a line. The more common things are, the more burdensome they are, the more funding is received by NIH. But there are a few things that are well below that line. And each one of them is a condition in which we blame the victim. Really interesting, like liver failure as an example, where somehow we don't feel like we need to study it as much because we blame the victim. And obviously there's stigmas associated with those same conditions, the way we approach people and the way we approach their disease and the way we talk about them and care for them. And so nowhere farther off that line is going to be overuse in addiction. And I think it's long overdue that we had a conversation about this, and long overdue that we began to study and discuss how to make this front and center in efforts to address what is one of America's most important problems. So thank you for joining us today.
Welcome, everyone. My name is Gary Mendell, and welcome to the first ever Stigma of Addiction Summit. It's my honor to be partners with Dr. Dzau in the National Academy of Medicine and Dean Johnston in Dell Medical School for what we all believe is so vitally important. My son, Brian, struggled with addiction for 8 years and tried so hard. However, on October 20th, 2011, I was woken up in the middle of the night by my cell phone ringing. My son had just died. He was 25 years old. And equally tragic, it wasn't just addiction that took my son's life. It was the feeling of shame he had every morning when he opened his eyes, of all day long feeling like an outcast, that caused him to wake up that morning, research suicide notes, write a note of his own, and take his own life, alone. And when my son died, he hadn't used a substance in 13 months. So why did he take his own life? I've never had to wonder. He told us in his suicide note. It's about not being treated like a human, he wrote, especially one who has worked so hard to get back to normal. My son didn't see a world where as a young man, he could develop a disease, get treated in our healthcare system, get better, and live a full and fulfilling life. As we all know, the addiction crisis is destroying families all across our nation. And so many have responded with wonderful initiatives in prevention, treatment, and recovery. However, what has been missed is one of the most important causes of this devastation: to end the stigma associated with this disease, those afflicted with it, and the medications that treat it. Recognizing this, Shatterproof worked alongside leading experts and developed an evidence-based plan to end addiction stigma. Our plan is rooted in social science and patterned after the most successful social change movements in our country's history. We are excited to present at today's summit leading experts, unite leaders, and showcase the importance of addressing stigma and highlight the promising initiatives that are taking place to end the shame and social isolation that is touching so many so horribly. I often think about the last time my son came home for a visit, 4 months before he died. And that last night, we're sitting on the back porch talking. He looked at me and he said, "Dad, someday, I wish that someday people would realize I'm not a bad person. I'm a good person with a bad disease. And I want you to know, Dad, I'm trying my absolute hardest." Well, Brian's wish has been way too far off into the future. So for the sake of the tens of millions of Americans who are struggling with this disease, let's drag addiction out of the shadows and into our hearts. I can't imagine a more perfect expression of humanity. Thank you.